OCD and the fear of dying. Confronting anxiety. Welcome. Today we're going to talk about something very important, OCD and the fear of dying. But don't worry, we'll make it easy to understand. Please be sure to watch until the end as we explore this important topic. Let's dive in. Number 1, introduction. Imagine if you couldn't stop worrying about something even if you knew it was silly. That's what it's like to have obsessive-compulsive disorder, or OCD. OCD is when people have thoughts that keep coming back and they feel like they have to do certain things over and over again to make those thoughts go away. OCD, obsessive-compulsive disorder. Sometimes people with OCD are really scared of dying. This fear can take over their lives and make them feel very anxious all the time. Number 2, what is OCD? So, what is OCD exactly? Well, people with OCD have two main problems: obsessions and compulsions. Obsessions, scary thoughts that won't go away. Obsessions are scary thoughts that won't leave you alone. Imagine thinking about something really bad all the time, even when you don't want to. Compulsions, things people feel they have to do to stop the scary thoughts. Compulsions are the things people feel they have to do to stop those scary thoughts. It's like a cycle. First, the scary thought pops up, then you do something to make it go away, but the thought keeps coming back. Number 3, OCD and the fear of dying. One of the scariest obsessions for people with OCD is the fear of dying. They might worry a lot about getting sick, having an accident, or anything else that could make them die. Fear of dying, an obsession in OCD that can make life very hard. This fear can make them do things like checking their pulse all the time, avoiding places they think are dangerous, or even doing special rituals they believe will keep them safe. Number 4, is fear of dying part of anxiety? Yes, being afraid of dying is a big part of anxiety, especially in people with OCD. When someone is always worried about dying, it's called thanatophobia. Thanatophobia, the fear of dying. This fear isn't just a passing thought. It sticks around and makes the person feel really worried all the time. It can even make them avoid doing fun things because they're scared. Number 5, what's it like to live with OCD? Living with OCD is tough. Imagine feeling like you have to check something or do something over and over again, even if you don't want to. Living with OCD, a constant struggle. When someone is scared of dying, it can make them feel like they're in danger all the time. This makes them super anxious and tired, and it can even make them feel alone because they're too scared to be around others. Number 6, can people with OCD be mean? People with OCD aren't mean, but sometimes their anxiety makes them act differently. They might get frustrated if something interrupts their rituals or if people don't understand what they're going through. People with OCD, not mean, just struggling. It's important to be kind and patient with people who have OCD because they're dealing with a lot of anxiety. Number 7, what happens if OCD isn't treated? If OCD isn't treated, it can get really bad. People might stop doing the things they love because they're too worried or too busy with their rituals. Untreated OCD can take over a person's life. It can make them feel sad, lonely, and even hopeless. That's why it's so important to get help early on. Number 8, why is OCD so hard to live with? OCD is hard to live with because it never takes a break. The scary thoughts just keep coming, and the person feels like they have to keep doing the rituals to stay safe. OCD, a never-ending battle. This constant worry can make life feel like a never-ending struggle. It's like being stuck in a maze with no way out. Number 9, why do people feel like they're dying? Sometimes when someone is very anxious, they might feel like they're dying. Their heart might race, they might feel dizzy, or they might have trouble breathing. Anxiety symptoms can feel like dying. These feelings can make their fear of dying even worse, creating a scary cycle that's hard to break. Number 10, what are intrusive thoughts? Intrusive thoughts are those scary thoughts that just pop into your head and won't go away, no matter how much you try to ignore them. Intrusive thoughts, scary thoughts that keep coming back. For people with OCD, these thoughts can be really upsetting, and they might even feel like they're bad people for having them. But it's important to remember that these thoughts don't mean anything about who they are. Number 11, why are people scared of death? People have always been scared of death because it's something we don't know much about. But things like pandemics or seeing sad news can make that fear even stronger. Fear of death can be made worse by scary events. For someone with OCD, these events can make their fear of dying take over their life. Number 12, how to stop scary thoughts. If someone with OCD wants to stop their scary thoughts, they can get help from a therapist. One way is called exposure and response prevention, or ERP. ERP, a way to help with OCD. ERP helps them face their fears without doing the rituals. Over time, this can help them feel less scared. Number 13, what does severe OCD look like? Severe OCD can make someone's life very hard. They might spend hours every day doing rituals or avoiding things that scare them. This can make it hard to go to school, have friends, or enjoy life. Severe OCD can take over a person's life, but with the right help, they can learn to manage their OCD and start living life again. Number 14, the hardest types of OCD to treat. Some types of OCD are really hard to treat, like when someone has scary thoughts about hurting others or themselves. These thoughts are called taboo thoughts, and they can make people feel very ashamed. Taboo thoughts, scary thoughts that are hard to talk about. But even though these thoughts are hard to talk about, getting help is really important. Therapists can help people with these thoughts feel better and understand that the thoughts don't define them. Number 15, can people with OCD live a long life? Yes, people with OCD can live a long and healthy life, especially if they get the right treatment. OCD doesn't affect how long someone will live, but it can make life harder if it's not treated. Life with OCD can be long and healthy with help. With the right support, people with OCD can live happy, fulfilling lives. Number 16, how to deal with the fear of death. If someone is scared of dying, it can help to talk to a therapist who can teach them ways to feel less worried. They can learn to focus on living in the moment instead of worrying about what might happen. Dealing with the fear of death, focus on living. Finding things that make life meaningful can also help them worry less about dying. Number 17, how to overcome crippling OCD. Overcoming OCD can be hard, but it's possible with the right help. Therapy, medication, and support from friends and family can make a big difference. Overcoming OCD, get the right help. The most important thing is to keep trying even when it feels tough. Number 18, treating severe anxiety and OCD. Severe anxiety and OCD need a special kind of treatment plan. This plan might include therapy, medication, and other ways to help the person feel better. Treating OCD, therapy, medication, and support. It's important to have a good team of people who can help, like doctors, therapists, and loved ones. Number 19, the role of support networks. Having a support network is really important for people with OCD. This means having friends, family, and professionals who understand what they're going through and can offer help. Support networks, friends, family, and professionals. With the right support, people with OCD can learn to manage their symptoms and live happy, healthy lives. Conclusion: OCD and the fear of dying can be really tough, but with the right help, people can learn to manage their fears and live full, happy lives. Conclusion: with help, life can be happy. Remember, if you or someone you know is struggling with OCD, it's important to reach out for help. There's always hope and things can get better. Thanks for watching and take care.